Okay, now it's time. We're going to start recording. So just a reminder to Brittany so that she will record. And please, everyone, do your best to keep the background noise to a minimum. Thanks. Now, I am so happy to introduce to you someone that is very famous in our world, Toni Moore. She is going to do a talk for us today on our National Outcome Measurement Survey, and she's the chairperson of that committee. Toni also is the president and CEO of Philos Hospitality, formerly Hospitality House of Tulsa. Toni has been talking since I've been with the HHN 9 years now about outcome measurements. I know I personally have learned a lot from her, and I can't wait to see what the committee and everyone has come up with to make our form of measuring national so that we can compare apples to apples. I'm very excited about it, and also I'm very grateful to the other people on the committee, Beth Brown, Andrew Gutzmaker, Roger, I'm sorry, Roger, I don't know how to say your last name, Kenevi, Debbie Fraley, and Talia Giordano. So thank you, folks.
Joan, thank you so much. On behalf of the committee, I just want to say thank you guys for calling in and participating in this Ask the Expert. Joan does a great job every month pulling together the experts in our field so that we can all learn and grow and support our houses, and more importantly, support the families we serve. So Joan, thank you for all the work you're doing. I want to thank the committee, Beth, Andrew, Roger, Debbie, Talia, for all of your work that you've been doing over this last year, really, even a little longer, as we've been progressing through creating a national outcome measurement survey for our houses. This call really is about the committee giving you an update on where we are in that process. We've had a lot of interest over the last several years in outcome measurement, and many houses have wanted to do an outcome measurement study, but just didn't have the resources or the experience to be able to do it. This benefit to your membership will be incredible, not just for the National Association, but truly for you locally on many levels as you participate in this survey. So I'll go ahead and move forward with where we're at. So what are program outcomes? Goals are general, they're broad, kind of abstract statements about where you want to be, but outcomes are more specific and narrow. They're measurable. These are things like how many hours of sleep was the caregiver receiving before they checked into your house versus after they checked into your house. How many meals per day was the caregiver eating before they checked in versus after they checked in? What was the stress level of the caregiver or the patient before they checked in versus after they checked in? So those are measurable, specific, related to our line of business, related to the mission that we carry forward every day. And in that, you also will find statistics. Statistics are not outcomes, however. When you report to a funder that you have served 550 families this year, that's exactly what you're telling them, that you've served that many families, but you've not reported the difference that you've made in the lives of those 550 families. And so that's where outcomes come into play. And as we kind of move forward with this presentation, I really want to encourage you to think in your mind as we talk about outcomes, what difference are you making that solves the problem that your funders care about? So in our National Outcome Impact Survey, we are not going to be counting statistics. You should, as a house, already kind of know what your volume of numbers are. So how many families, how many individuals, what is your average length of stay? Those kind of statistics are specific to your house and your local organization. So we're not going to be measuring that with this particular survey. If you are having trouble or you don't have a tool in place to help you know what those stats are, I would encourage you to log on to the HHN website and look at the different tools and the different software pieces that our other members are using to do that. I think there are way more resources out there to handle statistics and registration now than there ever has been. And it's getting to be very creative on what some of the houses are doing. So let me encourage you for that. But this survey, this national outcome survey, is going to measure the impact that our programs collectively, our services collectively, have on our guests, which are caregivers and patients in the following area. How are we measuring the health care of the patient and the impact of what we do? How are we measuring the health, physical, and emotional indicators for that? Financial and economic measurements and the impact we have on a family, social service impact, and then access to care. So these are the things that you'll see covered in the survey as we move forward with this. So why is this information important to you, and why is it important to the National HHN Association collectively? One, I will tell you from my personal experience, and I've started doing outcome measurement back in 2009 is when I first started that. And I started it not because we had the money to do it, and not because we had the time to do it, and not because we had the resources and manpower to do it, but I started it because we were very grassroots, very small organization, and our waiting list was crazy, and we were growing, and we needed more space. And I went to a Funders Roundtable meeting in Tulsa. And if you don't know the philanthropic climate in Tulsa, it's a very, very giving community. We have so many family foundations here that are willing to do grants, and so many corporate foundations. It's very just a philanthropic environment in Tulsa. However, because it is, and because we have lots of nonprofits here, they hold us to a very high standard in how they give out their funding. And in 2000, and I believe it was 2007 or 8, at this Funders Roundtable meeting, they pretty much announced to all the nonprofits in Tulsa that going forward, that we were going to have to provide outcomes through outcome measurements in all of the grant proposals. That they appreciated the statistics, but they want to know, are we solving the problem that the funders care about? And we can't, and they said we will not give out fundings for grants if you don't have these measurables. So I knew right then and there, I didn't know what it was going to take from our little nonprofit, but we had to get this done. So that's what prompted me to move toward an outcome measurement base in our approach and how we followed up with our guests. So your grant application process, for most of you now, you probably are already seeing requests for outcomes. When you talk to major donors and supporters, this information is so valuable to them, it keeps them engaged. And of course, your healthcare system and hospital partners. Many of you are either on a campus of a hospital, or a hospital system is leasing you building or land, or you're just serving that one main hospital system. But we're always challenged to prove our worth. In healthcare, hospitality houses are what we call a non-revenue generating department, which means that in healthcare, you can't file a healthcare claim like you can for surgery, and receive back reimbursement from insurance in a format that makes your business profitable. That's what healthcare is looking at. So most hospitality houses, and I would dare to say 99.9% of them, are not going to be a revenue generating department for a hospital. So how do you show value? How do you show worth? And how do you show that you impact the bottom line of a healthcare entity? And that's what outcomes will give you. So in your grant proposals that some of you are seeing, you're probably noticing that you have a statement of need, and then you also have some narrative. In this particular example, this one says, this is the core of the proposal. It reinforces the goals, objectives, and desired outcomes of the project, describes the activities of the project, who will participate, the implement of these activities, and the timeline, and then the outcome, what will change as a result of realizing your objectives, focusing on the benefits. So I'm sure you guys are seeing this in some of your grant proposals. I've been seeing it for years. Okay, so the tool itself is a survey tool, and the timeline on how we went through this, in April of May of last year, we identified the committee members, and we wanted to make sure we had a good representation across HHN of houses that serve patients and some that serve caregivers, cancer, transplant, pediatric and or adult and or young adult, and then a regional diversity across the country. And that's why you see, when you look back at the names of the committee, that's what you see. And I also will say these people were very willing and eager to help us get to this point. So I'm very grateful, because I am passionate about outcomes. I know everyone is not. And so I appreciate any of those that come alongside and help the process. Then from June 2017 to February 18, we began to have regular monthly meetings. And our objective was to take the Hospitality House of Tulsa survey that we've been conducting for a number of years and identify out of that what we want to measure nationally. And so we were able to get that done. We wrote the survey collectively with that in mind, and we made it an available survey for online or hard copy. And I'll talk a little bit about the differences of those in a minute. Then in February and April of this year, we have begun testing that beta survey within our own houses. So there are 5 of us that are conducting these beta surveys, which include drafted cover letters or email cover letters that are going out. And we're planning the logistical pilot testing of those surveys. So we're in what we call a beta test for the survey. We're not in the final survey yet, but we're in the beta part. So when we get the pilot surveys back from our participating committee houses, then we'll know if we need to tweak the questions a little bit, tweak the response options, or change some of the terminology, because it may be confusing to those that are participating. So that's kind of where we're at right now. And then from May to October, as we're finalizing testing this out, we'll be receiving back the surveys from those houses that are participating in the beta test, and we'll make these edits. And then the exciting part is we will be prepared as a committee to present the beta testing survey results to you at the national conference in Denver. And we will be also presenting and going over the tool itself and then how you can participate in the final survey nationally and how you implement that in your house. So right now, our number of questions that we have in the survey is 30 questions. I know that seems like a lot of questions, but we have all taken the survey as if we were a caregiver or as if we were a patient, and it takes about 10 to 15 minutes to complete that survey. And I will tell you that the cover letter or the cover email that is sent before the survey, it is worded in a way that will prompt your guest or prompt your patient to want to help you. So just know that we're looking at all of that information as a tool so you can have participatory involvement in your guest. It will be available as an online survey, so it will have a link that you can copy and then provide that within an email. And we're also providing it as a hard copy survey if you choose to mail out the survey. And each house can determine which format that they want to use, either an online or the hard copy. There are benefits and disadvantages to each one of those formats. Benefits of the electronic survey, it decreases your staff time involvement. It tends to include participation of younger demographic guests, and data collection is easier because as your guests are clicking on the boxes or the buttons, the data is preloading into the survey tool for you. Benefits for hard copy survey is if you have an older demographic of patient or guest, they will participate more in providing that information in a hard copy. So as you guys think about your houses and how you want to collect your data, I need you really to think about who your demographics are of people that stay in your house. And here's an example. In Tulsa, our average age of guest is 50, and our highest age of guest can go up to 82. We've been doing the paper copy survey for this last year and a half, and I have about a 28 to 30% return rate on my survey. That's very, very high. But we have houses like Andrew's house at Matt Anthony's or we have Roger's house, which serves young adults. And in those two cases, their demographics would lend themselves to their people participating on an online format because they can use their phone to click their answers, or they can log on with their computer or their tablet. So that's the difference. You really need to think about which format is going to be best for you, because these are not just national outcomes that you're measuring. These are your local outcomes you're measuring. So when we collect everybody's data together, we'll be having these apples to apples, oranges to oranges comparisons that we can do, which is wonderful. But you want to use your own data to also report to your local funders. And so when you present this survey to them, you can present the national outcomes, but you also want to present your local outcomes, possibly even in comparison to the national outcomes. And when you look at and it should be asked by the funder, and it should also be presented to the funder, what your return of participation was on your survey. So I'm always, 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 always happy to tell my funders that we had a 25 to 30% return rate on our survey, and they're always in shock and amazed, because really when you do a survey, if you're getting 10 to 15% return rate, that's pretty good data. If you're getting close to 30%, that's hard data. That's very difficult data to ignore. So I would just encourage you guys, look at your demographic of guests, look at your demographic of patient, and determine who is best, which format is best for who you're going to be surveying. Some of you that are doing a large pediatric patient volume or a lower adult age patient or caregiver population may be better off doing the electronic version. Some of you that have older senior adults, it may be the paper version. So that's going to be your choice. And when we get back to the conference and we've gone through the pilot project, some of us have done paper, some of us will have done electronic. We'll be able to report back to you what percentage of return rate we had in each of those formats and kind of what our demographic looked like. I hope that made sense. Custom questions. So if you want to add custom questions to your survey, you must do so by including an additional link And I would encourage you to just limit that to 5 questions. I think when you see the outcome questions, we're going to probably capture the majority of what you're interested in reporting, but there may be some things that you want to take it to the next level. There may be programs that you do specifically at your house that nobody else does, or we definitely don't measure it nationally. An example of that is Hospitality House of Tulsa is a Christian faith-based organization, and we provide prayer support. So on our outcome measurement, one of our custom questions has to deal with the outcome measurements of prayer support. You may have another program that's not identified in the national questions that you may want to survey, but let me just say, limiting those additional questions is going to be helpful to your participants in your survey. Now, if you have the paper copy one, you can just include an additional page not provided by HHN with your custom questions and be able to participate that way. There will not be an option of editing or altering the survey tool. So we are presenting the survey from a caregiver's question perspective or from a patient's perspective if you're caring for patients, but you are not able to go in and change those national questions, because if we allowed that, it completely takes away the integrity of the survey from the national and the comparative position, and the data would end up being skewed. Okay, so our next steps are the pilot and beta testing, and then presenting and training you at the conference on how to implement this in your homes. And you can sign up to participate at the conference, or you can do that online when we announce it in the fall. Now, similar to other things that we've designed within the HHN network, this information will be extremely valuable. I will tell you that when we started doing outcome measurements, before we were doing outcomes, our operating grants were coming in at $5,000 to $10,000. And after we started doing outcomes, our operating grants became $25,000 and $30,000 because we had the data. We were going into an expansion campaign, and because of the outcomes, we had funders and grants coming in the $100,000 to $150,000 range. We were able to show outcomes and open a new program, which is our hotel extension program, for another hospital system. And we report to them the outcomes specific to that program now on an annual basis. And they have renewed that contract with us for the hotel extension program for the 3rd year. So I have one foundation that writes a $200,000 check every year for that program for their hospital. So that's the kind of results that you see. So when we talk about investing, your time, your staff time, your volunteer time, when we talk about investing in this tool, we recognize it is an investment, but we want everyone to participate. And so for those that participate and your houses and your guests are surveyed and you're managing that survey tool, the outcomes from the national and from your local outcome measurement study will be free to participating members. If you're a member of HHN, but you can't participate in the national survey, and we understand there's some that probably would not be able to, then the cost for you to receive the national tool, you won't have a local tool because you didn't provide that data, but from the national tool, the outcomes would be a $200 fee to provide that data, which is a very small, I think it's a very small investment compared to what I see in the increase of grant dollars coming into your organization. And then non-member of HHN, you're one of our HHN friends, but you haven't joined, but you love to get on our website and find tools, and you can still receive this tool for $350. Still a great price for the investment and the return on investment that the organization is going to be putting in. And I think we're ready for questions, and I hope I've got some of the committee people on here too that may be willing to help me answer some of the questions that you guys may have.
Hi, this is Bettina. Can you hear me?
I can.
Hi, I'm with JW Health in California, and I'm so excited that you are doing outcomes. I love outcomes. And we are doing an expansion effort here too, and I think we can really replicate our model if we can prove that we're really helping with the bottom line. I'm pretty new to the industry, and I would love to be more involved in supporting the outcomes. Is there an opportunity to join the committee or get more involved with the outcomes development?
I think so. We certainly would welcome a few more committee members, especially in the beta testing time. So if that's something you're interested in, if you could email Brittany at the national office or Kristen and just let them know what your interest is, and then I'll follow up with you and we'll figure out what the best place for you to get engaged in.
Sounds great. Thank you. Thank you for your work too. It's most excellent.
Thank you. I appreciate that. Other questions?
Hello.
Go ahead.
Hi, this is Mona Theobald, a board member at Kathy's House in Milwaukee, Wisconsin. Is it possible to get a preview of the questions to look at?
We could, but I think we need to get through the beta part, because the beta part is really just what I said. It is test questions. When we get those back, we may be tweaking some things. And so we're kind of waiting on presenting that. But what I kind of went over with you on the phone earlier, giving you those examples, is out there. And also, if you want to look at Hospitality House of Tulsa's outcome measurement study that we did back in 2009 and 2010, those that survey and those results are out there on the HHN website. And so you can go and look at my survey and my results, and the questions are similar. They're not the same. The answers or the options to answer are not the same, but you can kind of get a feel for what that outcome measurement tool looks like. Does that help?
Okay. Yeah. And one follow-on question: in this survey, is there any, not if it's going to a guest, I guess, or a patient, but is there any thought to understanding the outcome impact from the provider's perspective?
From the house's perspective, is that what you're saying?
No, from the healthcare providers, from the hospital.
Right. No, we did not include a survey specifically for the social workers or case managers at this stage of the survey. Now, I will tell you that this is the first layer of outcomes, and this, the results of this, I think, help set a pretty good bedrock for us to build more data on. We won't be doing outcome measurement surveys nationally every year. It's just too big a project to take on. Yep. However, you have the tool now that if you want to continue surveying your guests, you can do that. And I think that's an excellent idea when we go into the kind of the second layer of outcomes, is for us to look at the healthcare provider perspective and let them answer from their perspective, which those questions are going to be completely different.
Exactly.
Yeah.
Okay, thank you.
Oh, thank you. Thank you for serving as a board member. We appreciate you guys.
Judy has a question. Tony, I think you're on.
Yeah. Hi, this is Judy from the Hospitality House, Southwest Michigan and Kalamazoo, Michigan. When we do the surveys, will we be able to choose if we want to use a hard copy or an online survey dependent on the guest, or will we have to make a choice that it'll all be hard copy or all online?
This is a great question, and I don't think the committee has actually thought through that to that level, but you as the house will choose your demographic, or excuse me, you will choose the patients or the caregivers that you want to survey. Now, if you want to divide your survey by age and say, I'm going to send this population the online link, and I'm going to send this population of my sample the hard copy.
Okay.
I don't think there's any reason you can't do that.
Okay.
You would just want to know what your investment of time is for each one of those formats.
Right, right.
Does that make
Okay.
sense?
Yes, it does. Thanks.
Mm-hmm.
And Tony, we had a question from Amanda Milner. She said, when do you estimate the national survey will close and results will be available?
Oh, that's another great question. When we get to the conference in Denver, I think we'll have a better answer for you in terms of that timeline. I know for the beta tests that we're doing, our houses, we're going to go back and survey all of our 2017 house guests, whether that's a caregiver or a patient. So we're using that as our population. By the time we get to October and we have the survey tool completed, we are going to suggest you guys use a 12-month period. And so at that time, the committee, I think, will give a recommendation on whether we're going to do previous 12 months or whether we're going to do 2018, or kind of what the timeline is, so we can, again, measure apples to apples and oranges to oranges in a time frame when we report that. And the thing about the time frame you need to kind of know, and it kind of plays back into why we're not doing this every year. Healthcare is changing rapidly. We're just in a very interesting flux of how insurance companies and hospitals and rural hospitals and government is just flipping things around, as well as private for-profit healthcare entities. So we're going to see some changes in healthcare that are going to be happening over the next 3 to 5 years. So when we repeat the survey, we want to repeat it at a poignant time so that we have a comparison to what healthcare looked like when we surveyed prior to this. That helps us kind of give some trending as well. So that kind of thing we kind of take into consideration. I think when the committee comes together in October, we're ready to announce and train you guys. We will give our best recommendation on which timeline and time frame your sample population should come from. I hope that answers your question.
And we also had a question from Barb Waite. She said, I'm correct in assuming since we don't have guests yet, they're a provisional member, we would have to pay the $200 fee.
That would be, from my perspective, that would be correct, but I'm going to defer that to Kristen for final answer. And I don't think she's on the line today, so that may be a phone a friend kind of thing. So. Any other questions?
Judy, I think, has another question. I'm going
Yes, Judy.
Unmute you, Judy.
Mizzou. I'm just finishing a capital campaign to build 2 new houses, and
congratulations.
Thank you. But this type of information was indeed asked for, and I can see where it's going to be so valuable going into the future.
Yeah.
So
yeah.
Thank you to all of you on the committee for putting your time into it and getting us ready for it.
You're welcome. We're all happy to serve.
Does anyone else have any more questions for Tony?
Well,
I just want to say thank you and tell you that thank you to everyone on the committee, and I think this is going to be a game changer for a lot of us.
I hope so. We've been talking about doing a national outcome survey for a few years now, and it's finally here. So I'm very excited that this is going to be provided as a benefit to our membership, And I'm looking forward to seeing everybody at the conference in Denver when we get to actually unveil the beta testing results and begin training you guys on how to implement this at your house.
That's awesome. Thank you, Tony. This is going to be really great for all of us. Great information.
If you would like, you've got the committee members listed at their houses on that second slide. I would just encourage you guys to drop them an email and say thank you, because they really have put in a lot of work and a lot of time above and beyond running their house, above and beyond their other responsibilities with HHN, and I am extremely grateful to them.
Okay, well, I think that this has been a wonderful session, and everyone should be very excited about taking that trip to Denver, if for nothing else, for this. And there's going to be a lot more there, so I hope I'm going to see a lot of you in Denver. I think we'll say goodbye for today, and we will see you all in June for the next Ask the Expert. And in the meantime, hope everyone has a wonderful month and enjoy spring. Thanks again, Tony, for everything.
So much.
Okay.